All righty. Well, I believe that we do have our program with us today. Is Chelsea with us?
I am here. We made it. Yes. Thank you for having us. It's nice to see everybody. This is more people than I've seen, besides at the grocery store in a long time.
All right.
I
All
have my
right. Well,
colleague Derek with me here as well.
excellent. Well, Chelsea, I'm going to go ahead and let you get started. We kind of got a little further behind than I wanted to. So go ahead and introduce yourselves and take the floor.
Wonderful. Well, thank you again for having us. My name is Chelsea Peterson. I am completing an internship currently with Knight Cancer Institute with OHSU. But I am actually wrapping up my master's program at the moment. So I will graduate virtually like this in a couple of weeks with my master's in public health. So I have had the opportunity to work with a team of individuals over at Knight, and most of us are located here in Portland, but there are other individuals on the team that are in Bend and other parts of Oregon, and we are the core team. And so we are community outreach, research, and engagement. So the role of the team at Knight is to basically, we're working to improve cancer outcomes. We're trying to decrease cancer in Oregon. And the aspect that I'm working on specifically is working toward decreasing human papillomavirus, or HPV, here in Oregon. So that's kind of what my project has been. We had the chance to put together some slides discussing HPV, different cancers that are associated with it. But we also have a number of other projects, and I want to let Derek go ahead and introduce himself. And he also has, he works full-time for Knight, and he has a lot more information about kind of some of the other projects that we work on as well.
Oh, hi. Thank you, Chelsea. Hi there. My name is Derrik Zebroski. I'm a community health educator at the Knight Cancer Institute. As Chelsea mentioned, I'm part of our community outreach, research, and engagement team. And as she mentioned, we do outreach for a lot of different cancer topics. Right now, the focus is on HPV. We also have a similar program that we're running to help educate people on clinical trials, exactly what they consist of, and the value that they bring. And in this rotating series, we also do a lot of community health education around colorectal cancer screening, and trying to be ahead of the game on that. Thank you guys so much for hosting us. We're really excited to be here. Chelsea, do you want to explain exactly how the survey and the presentation are going to go?
Yes, so we have had to kind of, Bryce has been an amazing and accommodating individual getting us here, because we had, originally intended that we would be taking this presentation into the community. I would be delivering, Derek and I would be delivering with a presentation, but while, communicating with the group. Essentially what we're doing is we're trying to study the attitudes, knowledge, beliefs kind of behind how people perceive and how they feel about HPV. And we are kind of, when we had to move everything online, the research process and getting all of the approval from, the research board took us a little bit. And we ultimately landed on having a platform where we have a pre-recorded presentation to avoid any hiccups if there is any with Zoom, or I don't know if anyone's been experiencing that, but we've had a couple of hiccups. And so we have a pre-recorded presentation. And so this is, essentially we are conducting research. And so we will be starting this presentation, and it will begin with a pre-survey. And the pre-survey will let you know, and you'll see a longer description, that if you are not interested in participating, you certainly do not have to. You can still just view the presentation, and you do not have to actually take part in the pre or post survey. Is that right, Derek? I want to make sure I don't mess that part up. They're able to still view the presentation even if they're not interested in participating in the surveys, correct?
Yes, totally. So there are three parts to this. There is, as she mentioned, there is the pre-survey, which just kind of gauges general knowledge around HPV. The presentation itself, which is a 9-minute YouTube video of a presentation, which Chelsea has recorded, and then a post-survey, which is a knowledge test of the survey of the content in the presentation. Are we at a point where we want to play the video? Is everybody? Yeah, yeah. Okay, I'm seeing a lot of nods, so I think we're going to go ahead.
Hello, and thank you for taking the time to be here with us today. At OHSU Night Cancer, our mission is to end cancer as we know it. We appreciate your participation. Today, we will focus on human papillomavirus, or HPV, and its associated cancers. So what is a virus? A virus is a simple microorganism that can infect healthy cells in the human body and potentially cause disease. Human papillomavirus is the most common sexually transmitted infection in the United States. Around 79 million Americans are currently infected with HPV, and it is estimated that around 14 million people will become newly infected each year. HPV is so common that most people who are sexually active will get the virus at some point in their lifetime if they do not receive the HPV vaccination. HPV is transmitted through sexual intercourse, including vaginal, anal, oral, and other intimate skin-to-skin contact. The infection is easily passed between partners, and although condoms decrease the likelihood of transmission, they are not guaranteed to completely prevent it. There are two types of HPV, low risk and high risk. With low risk HPV, symptoms may not be present, or there may be the appearance of warts or lesions on the skin. These may appear in the genital area, but they may also appear in the mouth or throat. Lesions may appear years after contracting the virus, and it is recommended that a person seek medical attention immediately if they do appear. High-risk HPV types do not include visible symptoms, but they do have the potential to cause several types of cancer. Pap tests can be used to detect the presence of dysplasia or abnormal cells in the cervix. The body's immune system can often rid itself of the infection within 2 years. This is true for both high and low-risk types. HPV causes cancer when the virus infects a healthy cell and then causes that cell to multiply uncontrollably. If left untreated, this can lead to cancer, although this can take 10 to 20 years or more to occur. There are a number of HPV-related cancers in the United States, including cervical, oropharyngeal, anal, rectal, penile, vaginal, and vulvar cancers. Around 17,500 women and 9,300 men are affected by HPV-related cancer each year. This graph shows the different cancers that are potentially attributable or caused by HPV, alongside the actual rates caused by the virus itself. Cervical cancer is the highest, with 91% of cases caused by HPV. As you can see, the majority of each of these cancers is caused by HPV, which shows us that the majority of these types of cancers are preventable with vaccination. Here we see new cases of cervical and oropharyngeal cancer from 2000 to 2015 for both males and females in the state of Oregon specifically. Each year in Oregon, around 540 people are diagnosed with cancers that are attributable to HPV. Fortunately, it is possible to detect HPV. Unfortunately, cervical cancer is currently the only cancer with FDA-approved screening methods. The HPV test and the Pap test can be used individually, or they can be used simultaneously to detect high-risk HPV and cervical cell changes potentially caused by the virus. Screening is recommended for women ages 21 to 29, with testing recommended every 3 years. Women ages 30 to 65 are recommended to have HPV testing every 5 years, or HPV with PAP co-testing every 5 years, or PAP testing every 3 years. Women over the age of 65 should consult with their provider about screening recommendations for HPV. Moving into a vaccine and how do they work? A vaccine allows the body to have immunity against certain diseases. Vaccines are safe and effective to be used by the public. HPV vaccination protects the body against the virus from human papillomavirus. Scientists ensure the safety of vaccines by conducting clinical trials and post-licensure studies. Clinical trials are conducted before a vaccine is made available to the public and are conducted by manufacturers to inform the FDA as to whether the vaccine is safe, effective, and ready to be licensed for use with the general public. During post-licensure studies, researchers look for any rare adverse effects and monitor vaccine safety after the vaccine has been made available to the public. HPV vaccination can provide protection against infection from human papillomavirus. Gardasil 9 is currently available to prevent HPV and is approved by the Food and Drug Administration. The vaccine is safe and effective, and with any vaccine or treatment, there may be mild side effects, including pain or redness on the arm where the shot was injected, or fever, nausea, or joint pain. The clinical trials for Gardasil 9 were conducted with 15,000 females and males, and the original Gardasil was studied in clinical trials involving more than 29,000 males and females. The Centers for Disease Control and Prevention develops recommendations for all vaccinations, including HPV. The CDC recommends vaccination for young people ages 11 to 26, but can begin as early as age 9. For young people age 11 to 12, a 2-dose series is recommended. Adolescents who receive their first dose at 15 or older will require a 3-dose series of the vaccination. The vaccination can also be administered after age 26 with a doctor's approval. Here we see Oregon vaccination rates for adolescent males and females from 2013 to 2018. Vaccination rates have been improving in recent years. However, there is still room for improvement. This graph shows HPV completion rates by county in Oregon. Multnomah County has the highest rate of completion at 60%, whereas Curry County's rate is only about 25% in comparison. Therefore, overall, Oregon still has some room for improvement. Australia is set to become the first country to eliminate cervical cancer by the year 2035 due to their early adoption of the HPV vaccine and HPV-based cervical screening and high participation in the national screening program. Additionally, many schools chose to participate in the national HPV vaccination program, effectively reaching large numbers of young people. Thank you so much for your time. If you have any further questions, or if you would like to know where the HPV vaccination is available near you, please contact your primary health care provider for more. And please take a moment to complete the post survey following this presentation.
Thank you so much for bearing with us and for viewing that. Again, I know it's not exactly the most entertaining, but we do appreciate it. We appreciate your time. So if you would not mind going ahead and jumping back over to Qualtrics, that will be where you can complete the post survey. that is also where we will be able to get the info so that we can know where to send your Amazon gift card as well.
Does anybody have any questions about the content that was shared or any feedback?
Well, Derek, I for one am somebody who is very interested in any form of cancer that comes up, as I'm a kidney cancer survivor.
Awesome.
Well,
Okay.
Thank you
We're
so
hoping
much.
we would hear some great, oh, sorry.
No, it's okay. Go ahead, Chelsea.
I was just gonna say we were kind of, we were wondering if we would get to hear some personal things about any of it, regardless. Going out into the community, we were that's what you kind of hope for, is a little bit more of that engagement. So thank you for sharing that. That's really cool to hear. Sorry to interrupt you, Derek.
Nope. Nope, no interruption. Thank you for that feedback. I hope you learned something from it. We also, as I mentioned, we're also doing a similar training about clinical trials, the process and the benefits of them. At the night, we have a number of clinical trials, one of which we're rolling out is called the Pathfinder program. And that is what we're hoping will be like a blood test for over 40 different types of cancer, just with one blood draw, instead of having to get specific tests for specific cancers all the time. So if you're interested in that, I'm also going to share a link to our Knight Cancer Institute website, and we have a page on there where we share information on all of our clinical trials.
Excellent. All right. Any other questions for Chelsea and Derek?
Just a comment. I've a survivor who spent quite a bit of time on the 10th floor at OHSU, and I'm very familiar with the Knight Center, and my hat is off. They have made me a survivor.
Oh gosh, that's amazing, Richard. Thank you for sharing that.
Yeah, Dr. Okada.
Richard and I shared the same oncologist together there at OHSU. Probably sat in the same chair at some point too.
Wow.
That's incredible. We love to hear stories like that. It's always inspiring.
It is, because you do hear, you of course always do hear sometimes the opposite, that people aren't always getting the healthcare that they want and need. And so it really, really warms my heart to hear that you guys felt good about it, and that OHSU took good care of you. We're glad you're here.
Absolutely. Well, thank you so much for coming and joining us today. I'm not 100% sure that survey that you had us take wasn't an IQ test. I sure hope it wasn't anyway, because I'll tell you what, I think I failed that one miserably. My gosh.
Isn't it amazing? I mean, I go to school for this stuff. I've been in many classes, and so much of this information was still brand new to me as well. I mean, even just the idea that Australia is nearly, they're going to be able to almost completely eliminate cervical cancer. I think that's just amazing. And you'd think that would be a bigger story, but granted, right now our news stories are pretty limited to everything that's going on, and that kind of, that makes sense. But it's been pretty interesting. So I feel like we're all kind of in that boat of like, oh, wow, I did not know a lot of this.
Right. Yeah. I definitely fall into that category, and I beat cancer 14 years ago. So with the help of Dr. Okada and OHSU, and the Knight Institute, probably. I'm sure they had their hand in it back then.
That's amazing. I really can't wait to be able, as part of my internship is, putting together a portfolio. So this personal feedback, this stuff is really, really great, because it makes it feel even more valuable and even more worthwhile to know that what we're doing is important and makes a difference.
Yeah. One last thing I want to mention really quickly is that some of our direct supervisor, Chelsea and I's direct supervisor, is one of the principal investigators on the Key to Oregon study. You may have seen some information about it on local news or in the Oregonian. And that's a test where we are trying to we are doing a random selection of 100,000 households throughout Oregon, throughout the population of Oregon, where these people do temperature checks and answer other survey questions every day, so we can try to get a grasp on where
Yes,
the COVID-19 virus is impacting the state and where the resources need to be sent at specific times. So if you were selected for that, you would have received a Key to Oregon postcard in your mail sometime in the last week. And then after that, you'll receive a letter that has instructions on how to sign up. But it's a very, very worthwhile study. And it's just, we are partnered with with OHA and the governor's office, just trying to get a population distribution sample to get an idea of where the virus is impacting the state the most. So keep an eye out for that. If anybody has any questions or anything related to it, I'm going to put my email address in the chat box. Please save that and feel free to reach out to me directly if you have any questions, because I'll be happy to answer any questions or support anybody if they're interested in that study.
Fantastic. All right. Well, thank you for that, Derek. Really appreciate it. Thanks again, Chelsea.
Thank you all so much for having us.
Keep up the good work out there. Really
You as well.
appreciate it.
You as well. Take care. Thank you.
Thank you.